Most men think losing their morning erection is just a normal part of getting older. But let me gently challenge that idea. If you've been told that's just a part of aging, I'm here to tell you that's not the full story. Many of my patients believed their vitality was gone for good, but what modern science shows is a message of hope. Your body isn't broken. It's just disconnected from its natural signals, and we can help re-establish that connection. I'm Dr. Sarah, and with over 20 years of experience helping men over 60, I want to share something that comes from both cutting-edge research and real patient success stories. Subscribe now, because this information offers a path forward that most doctors never discuss. In the next few minutes, I will reveal 3 specific points on your body that, when activated correctly, can naturally reawaken morning vitality without pills. This isn't about forcing anything. It's about reconnecting with a system that is still there, just waiting for the right signal. You see, what many people don't understand is that your morning vitality isn't controlled by just one system in your body. It's actually a beautiful collaboration between your circulation, your nervous system, and your hormone signals all working together like instruments in an orchestra. When we're younger, this orchestra plays in perfect harmony without us even thinking about it. But as we age, it's not that the instruments break, they just need a gentle reminder of how to play together again. Let me share Robert's story with you. Robert is 68, a retired electrician who spent 40 years keeping the lights on in his community. He came to me already working beautifully with his cardiologist, managing his blood pressure with great success. What Robert wanted was to explore natural approaches that could work alongside his medical care to support his overall vitality. Robert told me, "Dr. Sarah, my doctor says my heart is doing well on the medication, but I miss feeling that morning energy I used to have. Is there something I can do that won't interfere with what's already working?" This is exactly the kind of partnership I love to be part of. After coordinating with Robert's medical team, we added these gentle activation techniques to his morning routine. Within 3 weeks, Robert noticed he was waking up feeling more connected to his body. His cardiologist was pleased that his blood pressure remained stable, and Robert felt empowered, knowing he was actively supporting his own wellness. Today, 6 months later, Robert continues both his medical care and these natural approaches, feeling more vital and confident than he has in years. Now, let me explain exactly what happens when we activate these 3 specific points. Think of your circulatory system like a well-maintained plumbing system in a beautiful old home. As we age, the pipes don't break, but sometimes the water pressure needs a gentle boost at key connection points. These 3 points I'm about to share with you are like master valves that can help encourage better flow throughout your entire system. The wonderful thing about this approach is that it works with your body's own wisdom, not against it. Research from respected medical institutions shows that targeted gentle pressure at specific anatomical points can help improve circulation and nerve signal transmission in men over 60. In my practice, when patients use these techniques with their doctor's knowledge, they often tell me they feel more aware of their body's natural rhythms and more optimistic about their overall health. The science is encouraging, and the real-world results speak for themselves. What I'm about to share isn't about forcing anything to happen. It's about creating the right conditions for your body to remember what it already knows how to do. Here's exactly how to activate these 3 master points. The foundation point, located just above your pubic bone. This first point sits right above your pubic bone, in the soft tissue area. Think of this as the foundation of a bridge that supports healthy blood flow to your entire pelvic region. When you apply gentle pressure here, you're encouraging circulation through some of the major pathways that supply this vital area. Here's how to find and activate it. Lie comfortably on your back with your knees slightly bent. Place your fingertips about 2 inches above your pubic bone, right in the center of your lower abdomen. You'll feel a slight soft spot between the muscles. Using gentle, steady pressure about the same amount you'd use to test if a tomato is ripe, press down for about 30 seconds. You might feel a slight tingling or warmth spreading through the area. That's perfectly normal and actually a good sign that circulation is responding. If you don't feel anything immediately, that's normal too. Some people are more sensitive to these sensations than others. Most people find the best time to do this is first thing in the morning, right after waking up, when your body is naturally transitioning from sleep to wakefulness. This timing works with your body's natural hormone rhythms rather than fighting against them. The control center, your pelvic floor area. The second point is located in your pelvic floor area, between your testicles and your anus. In medical terms, this is called the perineum, but I like to think of it as your body's control center for pelvic circulation and nerve communication. This area contains a rich network of blood vessels and nerve pathways that modern medicine recognizes as crucial for male pelvic health. It's like the central command station for your body's hydraulic system in this region. To activate this point safely and effectively, sit comfortably on a firm chair with your feet flat on the floor. You can place a small, firm cushion or rolled towel on the seat first. Position yourself so that when you sit down, there's gentle pressure right on this central point. The pressure should be noticeable but never painful. Think of it like sitting on a tennis ball, but much more gentle. Hold this position for about 2 to 3 minutes while breathing normally and deeply. I want to emphasize something important here. This technique creates very gentle pressure. If you've ever had prostate surgery or have any medical conditions affecting this area, please discuss this approach with your doctor first. They know your specific situation best and can guide you on whether this technique is appropriate for your individual health picture. The gateway point, your inner groin crease. The third point is located in the crease where your leg meets your torso on the inner side. This is right above where your femoral artery runs, making it a perfect gateway point for encouraging circulation throughout your entire pelvic region. When you place your hand on your hip and feel where your leg bends when you lift your knee, you'll find a natural crease or fold. Move your fingers about 2 inches toward the center of your body along that crease. You might even be able to feel a gentle pulse there. That's your femoral artery, one of your body's major highways for blood flow. Sit comfortably and place your thumb or the heel of your palm right on this point. Apply gentle, steady pressure for about 45 seconds on each side. The pressure should be firm enough that you feel it, but gentle enough that it's completely comfortable. Here's something important to know. You might feel your pulse under your fingers. That's perfectly normal and actually helps you know you're in the right spot. However, if you're taking blood-thinning medications like warfarin, or if you have any concerns about applying pressure over arteries, please check with your healthcare provider first. This is exactly the kind of question they appreciate because it shows you're being thoughtful about your health. I'd love to hear about your experience with these activation techniques. Have you tried similar approaches that work well alongside your medical care? Share your thoughts in the comments below. These 3 points work together like a team. You don't need to do them all at once, and you don't need to do them every single day to see benefits. Most of my patients start with just 1 point for the first week, then gradually add the others as they become comfortable with the techniques. What you can expect is this. Many people notice they feel more awareness and sensation in their pelvic area within the first week. Some describe it as feeling more connected to their body or more aware of natural circulation rhythms. The more significant improvements usually develop over 2 to 4 weeks of consistent practice. Now, these activation points are powerful on their own, but they work even better when supported by what I call the 5 foundation habits. These are simple daily practices that create the ideal environment for healthy circulation and natural vitality. Foundation habit number 1. Morning hydration ritual. Your blood is about 85% water, and when you're properly hydrated, everything flows more easily. But here's what most people don't know. The timing of your hydration matters just as much as the amount. When you wake up, your body has been without water for 6 to 8 hours. Your blood is naturally thicker, your circulation is slower, and all your systems are just waking up. Starting your day with 2 glasses of warm water, not cold, but comfortably warm, helps your cardiovascular system transition smoothly from sleep to activity. The warm temperature is important because it doesn't shock your system the way ice water might. Instead, it gently encourages circulation and helps your body temperature regulate naturally. Many of my patients tell me this simple change makes them feel more alert and energetic throughout their entire morning. Foundation habit number 2. Circulation supporting movement. Your pelvic area benefits tremendously from gentle movement that encourages blood flow without strain. Think of this as waking up your circulation with kindness rather than demanding immediate performance. Here's a simple sequence you can do right after you get out of bed. Stand with your feet about shoulder width apart and place your hands on your hips. Slowly rotate your hips in small circles, first 5 times in one direction, then 5 times in the other direction. The movement should be gentle and comfortable, like you're stirring honey with your whole pelvis. Next, do some gentle marching in place. Lift each knee just to hip height, no higher, and let your arms swing naturally. Do this for about 30 seconds. You're not trying to get your heart rate up dramatically, you're just encouraging your circulation to wake up gradually. Research confirms that gentle pelvic movement in older adults helps improve blood flow and can support overall energy levels throughout the day. This isn't about intense exercise, it's about moving with intention and awareness. Foundation habit number 3, stress-releasing breath work. Here's something fascinating that modern research has proven. Your breathing pattern directly affects your circulation and hormone production. When you breathe shallowly from your chest, which many of us do without realizing it, you're actually signaling your body to stay in stress mode. But when you breathe deeply using your diaphragm, the large muscle under your lungs, you activate what's called your parasympathetic nervous system. This is your body's rest and restore mode, and it's essential for healthy circulation and natural vitality. Here's how to do it correctly. Place one hand on your chest and one hand on your belly. When you breathe in, your chest hand should barely move, while your belly hand rises. Breathe in slowly through your nose for a count of 4, hold gently for a count of 2, then exhale through your mouth for a count of 6. Studies reviewed by medical institutions show that diaphragmatic breathing helps activate the parasympathetic nervous system, which supports better sleep quality, reduced stress hormones, and improved overall circulation. This is exactly the kind of internal environment where natural vitality can flourish. Do this breathing pattern for just 5 minutes each morning, and you'll be amazed at how much more relaxed and centered you feel throughout your day. Foundation habit number 4. Evening warmth therapy. Research evaluated by Mayo Clinic shows that applying gentle heat to your lower abdomen and pelvic area can cause vasodilation, a fancy term that simply means your blood vessels open up and allow better flow. This is particularly beneficial in the evening because it helps your body relax while supporting circulation to the areas we're focusing on. Here's the safest and most effective way to do this. About an hour before bed, take a warm shower or bath, or use a heating pad set on low over a towel on your lower abdomen for about 15 to 20 minutes. The temperature should feel comfortably warm, never hot enough to cause discomfort. I need to share an important safety note here. If you have diabetes, peripheral neuropathy, or any circulation problems, please check with your doctor before using heat therapy regularly. These conditions can affect your ability to sense appropriate temperatures, and your healthcare provider can guide you on the safest approach for your situation. Many of my patients tell me this evening, warmth ritual helps them sleep more deeply and wake up feeling more refreshed and energized. Foundation habit number 5, circulation supporting nutrition. What you eat directly affects how well your blood flows and how efficiently your cardiovascular system works. I want to share 2 specific foods that research shows can make a real difference for men over 60. First is pomegranate juice. A study published in the Journal of Evidence-Based Complementary and Alternative Medicine found that drinking pomegranate juice daily can help support arterial health and reduce oxidative stress in the cardiovascular system. The antioxidants in pomegranates, called polyphenols, appear to help blood vessels function more efficiently. I usually recommend about 4 to 6 ounces of pure pomegranate juice daily, preferably in the morning with breakfast. However, pomegranate can interact with certain medications, particularly statins for cholesterol and some blood pressure medications. If you're taking any heart medications, please mention this to your doctor before adding pomegranate to your daily routine. The second food is fresh ginger. Clinical trials show that ginger can help improve peripheral circulation. That means blood flow to your extremities and outer areas of your body, including your pelvic region. A warm cup of fresh ginger tea in the afternoon can be both soothing and beneficial for circulation. To make it, simply slice about an inch of fresh ginger root, add it to hot water, and let it steep for 5 to 10 minutes. You can add a touch of honey if you prefer a sweeter taste. Again, I want to mention that ginger can interact with blood-thinning medications and some diabetes medications. It's always wise to let your healthcare team know about any regular additions to your diet, especially if you're managing other health conditions. What questions would you ask your doctor about adding these circulation-supporting approaches to your routine? Comment below your questions. Help me create better content for our entire community of health-conscious men who want to age with vitality and wisdom. Now, let me address something that's probably on your mind. How long does it take to see results? And what should you realistically expect? In my experience working with hundreds of men over 60, most people begin to notice subtle changes within the first week to 10 days. These early changes usually involve feeling more aware of their body, having better sleep quality, or noticing improved energy during their morning routine. More significant improvements typically develop over 2 to 4 weeks of consistent practice. Some men tell me they feel more confident and optimistic about their health in general. Others notice that their morning routine feels more energizing and that they're looking forward to starting their day. However, I want to be completely honest with you. Everyone's body is different, and everyone's timeline is different. Some people see changes very quickly, while others need 6 to 8 weeks of consistent practice before they notice significant improvements. Both patterns are completely normal and healthy. The key is consistency rather than intensity. It's much better to do these techniques gently and regularly than to try to rush results by applying more pressure or doing them more frequently than recommended. I also want to acknowledge that this journey isn't just about physical techniques. Taking time each day to focus on your health and connect with your body is an act of self-respect and self-care. Many of my patients tell me that this daily practice gives them a sense of control and optimism that extends far beyond just physical concerns. You're not just working on circulation or nerve function, you're reinforcing the message to yourself that you deserve to feel vital and healthy, regardless of your age. That mindset shift alone can be incredibly powerful. There's something else I want you to know. It's perfectly normal to have days when you don't feel like doing these techniques, or days when they don't seem to be working as well. Your body's responses can vary based on stress levels, sleep quality, what you've eaten, or even the weather. This doesn't mean the techniques aren't working, it means you're human. On days when you're not feeling motivated, just do one of the 3 activation points, or just the breathing exercise. Something is always better than nothing, and maintaining the habit is more important than perfect execution. I encourage you to think of this as a conversation with your body rather than a demand you're making of it. You're offering these gentle techniques as a gift to yourself, and your body will respond in its own time and in its own way. Remember that you're not trying to turn back the clock or recreate exactly what you experienced in your 20s or 30s. You're working with your body as it is now, supporting its natural functions, and creating the best possible conditions for health and vitality at this stage of your life. That's actually a much wiser and more sustainable approach than trying to force your body to perform the way it did decades ago. Let me also say this. If you try these techniques consistently for 6 to 8 weeks and don't notice any improvements at all, that's valuable information to share with your doctor. It doesn't mean you've failed or that there's anything wrong with you. It might mean there are other factors affecting your circulation or energy that deserve medical attention. Your healthcare provider might want to check your hormone levels, review your medications, or explore other approaches that could be helpful. The time you've spent trying these natural techniques isn't wasted. It's part of taking a comprehensive approach to your health. Throughout this entire process, I encourage you to maintain open communication with your medical team. They've probably noticed that you're more engaged with your health and taking active steps to support your well-being. Most healthcare providers really appreciate when their patients take this kind of initiative. You might even share this video with your doctor and ask what they think about incorporating these techniques into your overall health routine. Many physicians are very supportive of gentle, natural approaches that complement medical treatment rather than replacing it. As we wrap up, I want to remind you of the 3 key points we've covered today. First, your morning vitality isn't gone forever. Your body just needs gentle reminders of how to access its natural functions. Second, the 3 activation points work by supporting circulation and nerve communication in your pelvic area, not by forcing anything to happen. Third, the 5 foundation habits create an environment where your body's natural healing and restoration processes can work most effectively. These approaches work best when they're part of a comprehensive health plan that includes regular medical care, good nutrition, adequate sleep, stress management, and appropriate physical activity. They're not magic bullets, but they are powerful tools that can help you feel more vital, confident, and connected to your body. I want to emphasize once more that everything I've shared today is meant to support your overall health and circulation, not to diagnose, treat, cure, or prevent any specific medical condition. If you have concerns about your health, particularly regarding circulation, hormone levels, or any aspect of your physical well-being, please consult with your healthcare provider. If this evidence-based approach resonates with you, please subscribe for more practical wellness education that honors your relationship with your healthcare provider. Share this video with someone who values both natural wellness and medical expertise. Together, we can help more men over 60 discover that aging doesn't have to mean accepting less vitality and energy. Your body has supported you for decades, and it deserves your attention, respect, and care. These gentle techniques are one way to show that appreciation while working toward feeling your absolute best at this stage of your life.